Hi, welcome to Public Health at Doorsteps. Today I'm going to talk about the variables that we are going to use in research. What is the significance of variables in research, and what are the definitions and what are the types with examples, and also how we are going to use these variables in presentation after the research, and what are their significance. Let us just have a look at it. Hi. So let us just have a look at it. The definition of a variable. A variable is any quantity that varies, any attribute, a phenomena, or an event that can have different values. And these values or these variables do supply certain information such as an indices of a person, indices of place, indices of time, or indices of any other information decided by a researcher. But these values will have a certain set of standards and method of measurement and scale of a measurement. All these standard definition, method and scale usually be decided in advance by a researcher based on a particular research. Let us just have a look at it, the types of variable. Broadly, they are classified into two categories: a quantitative variable and qualitative variable. Under quantitative variable, it's also called as a numeric variable. Under that, it has been classified into two subtypes called a discrete variable and a continuous variable. Under qualitative or a categorical variable has been classified into three types. Number 1, binary. Number 2, ordinal. And number 3, nominal. Let us just have a look at it into each of these variables, their definitions with example. To start with, what is a quantitative variable or a numeric variable? A variable that can be measured numerically is called a quantitative variable. The data collected on a quantitative variable are called quantitative data. In short, to say that anything that can be measured in terms of any number is called a quantitative variable or a numeric variable. Under which, further, if you look at the two types, as I said earlier, it's a discrete variable and continuous variable. What is a discrete variable? A discrete variable is a variable whose values are countable, is called a discrete variable. In other words, a discrete variable can assume only certain value with no intermediate values. For example, age in years, 23 years. Number of visits, clinic, 0, 1, 2. Number of blood transfusions, whether the particular patient had no transfusion at all, 1 transfusion, 2 transfusion, or 3 transfusion. And patient cannot say that he had 2.5 transfusions, or he cannot say 2.5 times I have visited the clinic. It should be complete number and it should occupy a complete value. What is the second category under a numeric variable is continuous variable. A continuous variable is a variable that can assume any numerical value over a certain interval, or interval is called a continuous variable. For example, age of children or students studying in a particular college range from 19 to 23. A blood pressure is 80 to 120 millimeter mercury. Hemoglobin level 11 to 16 gram per cubic millimeter. So this is a range of a particular measurement, and the value which lies in a particular interval is called a continuous variable. If the blood pressure starts from 1 to 120, 130, but we are going to define 80 to 120, or 40 to 60, 60 to 80, something like that. Let us just have further look at a further differentiation of these two variables. Continuous variable of a blood pressure 80 to 120 in a given scale that is shown in this slide. 80 to 120 is falls under continuous variable, whereas a discrete example where we count into a number, complete number, 0, 1, 2, 3, so on, so forth. So let us look at what is a qualitative or a categorical variable. A variable that cannot assume a numerical value but can be classified into two or more non-numeric categories is called a qualitative or a categorical variable. The data collected on such a variable are called qualitative data. A qualitative or a categorical variable has three subtypes. Number one is binary variable, and it is called binary if there are only two categories. For example, if for a particular question the answer is yes or no, or male or female, and it's high or low, such kind of two variables are categorized into binary. The second category in the categorical is ordinal variable, where it is in ordered. If there are more than two categories in ordered, it is called ordinal variable. To give an example, a pain is whether the person is having no pain, or having mild pain, moderate pain, or severe pain. The patient cannot say that he had one pain, two pain, three pain. It is more than two variables which cannot be quantified, that's how it can be subclassified into more than two. Another example is satisfaction level: good, bad, better, the best. The third type of categorical variable is nominal variable, where it doesn't fall in either binary or ordinal, and usually it is grouped under certain names it is given. Example: ethnic group, Asian, American, or African. Marital status is married, single, without, or separated. So in summary, to say that variables can be classified into two broad categories. One is quantitative and another is qualitative. Under quantitative, there are two further classification into discrete variable or continuous variable, and qualitative variable or categorical variable is classified into three categories. One is binary, second is ordinal, and three is nominal. It is used for, and presented in various forms. Usually the ordinal variable is used as frequency percentage, cumulative frequency, cumulative percentages, that can be presented in the form of pie chart, column, bar, or linear ogive. Nominal is presented in the table as frequency or percentage, and in the form of pie, column, or bar chart, and continuous in the interval as shown in the slide. In conclusion, the variable is a basic unit required to perform a research. The research has to select the list of variables relevant to a study or objective, or specify every piece of information and assign its role. The type of variable should be set in order to allow for proper data collection and transformation and presentation by a researcher. Thank you.